Go ahead.
Good evening, everybody. I believe we are now being live streamed. So I'd like to welcome you all to the Morden Community Forum. And I'm going to start off, I think, by introducing all the councillors here, or asking the councillors to introduce themselves. So from the top, Sally, do you want to introduce yourself?
Sally Kenny, Lower Morden Ward.
Stephen?
Stephen Allen Breety's Ravensbury Ward.
Nick?
Nick McLean, Cannon Hill Ward.
Mark? Just the order you're coming in on the screen here.
Sorry, I wasn't expecting that. I am Mark Allison. I'm the leader of the council.
Helena?
Hi, Helena Dollimore, St Helier Ward.
Jennifer?
Jennifer Gould, Cannon Hill Ward.
And Dickie? Do you want to introduce yourself? He is there.
Sorry, yes, I am here. Sorry, hello, Councillor Dickie Wilkinson at Merton Park Ward.
And thank you very much, all of you. And I'm Councillor Nick Draper from St Helier Ward. So we've also got Barry Causa here, Stephen Zekwe.
Ask Nick to introduce himself.
I have asked Nick. He did introduce himself. Stephen Navdeed Alg and Mark Gale. Oh, Dennis has arrived. Dennis, you're as a councillor. Would you like to introduce yourself? If not, Dennis Pierce, councillor from. Oh yes, Dennis, can you introduce yourself?
Yeah. Can you hear me?
Yes, indeed.
Dennis Pierce, St Helier councillor.
Nick, more than welcome. And there we have two other people, Mark Gale and User. Okay, so Mark Allison, would you like to give us a leader's report?
Yeah, thanks, Nick. Do you? I don't know if there are any local residents, so I don't know whether you want me to carry on, but I have an introduction of about 7 or 8 minutes, if that's okay with you, Chair.
Absolutely fine. Fine. You do as you will.
Okay, fantastic. I just wanted to use these opportunities to say thank you, first of all, to you guys representing Morden for inviting us. What I've found in the meetings that I've been to is what we've already known, really, that Merton's a great place. It's got a great community, and it is a privilege to have this opportunity to come to the community forums to listen to what residents think. I appreciate we're a bit light on residents and very heavy on councillors tonight, but you know what I mean. I'd just like to start by saying a little bit about myself, and you probably know that I've been a councillor for nearly 20 years now, and much of the last 10 years or so has been spent helping to manage the council's finances and ensure that the council's financially resilient. But away from money, I'm actually just very proud of and very part of the community, and that's what I love doing. I was born in St Helier Hospital. I lived most of my life. I have lived most of my life within a few hundred yards of St Helier Hospital. Fighting to keep St Helier Hospital is very important to me. I know it is for most of your residents. It's probably the top thing amongst Morden residents at the moment. So St Helier, but the wider point that I wanted to make is that I'm very much rooted and from the local area. I was elected, as I said, nearly 20 years ago, and where I live now is actually the furthest I've ever lived from St Helier. So it gives you an idea of my localness. So I'm very conscious of what a great community it is, about how this Merton is a place where people care for and look after their friends and neighbours. And we've obviously seen that a great deal during the pandemic, the way that the community has come together. But there are also huge challenges facing Merton, and in particular facing Morden. So, you know, alongside Morden, I would say that, sorry, alongside Mitcham, I would say that Morden is the most disadvantaged part of Merton. I would also say that things have really massively improved during the first 18 years that I was a councillor. But I would say that the pandemic has meant that over the last 18 months, if anything, we've started to see a backwards movement. So in that first 18 years, for example, we've seen school results improve massively. Places like Harris Morden, where, you know, to be honest, when it was Garth, we expected it more likely than not that you would go there and you would leave with next to nothing. And now the expectation is that if you go to somewhere like Harris Morden, we expect you to be the type of student who will go on to higher education. That's a massive transformation in the aspirations and life chances of local people, local children, in the time that I've been a councillor, and I'm very, very proud of the progress that we've made, particularly in that area. But whilst we've made progress in areas like education, it does seem that lots of things, as I said, have gone backwards during COVID-19, which has hit areas like Morden harder than many areas of the country. And, you know, something I wanted to get across to all of you guys is, you know, that recognition that life chances have been affected because people are from Morden compared to living in wealthy areas further out from London. That is one of the reasons why I have been asking the government to reconsider its decision on St Helier Hospital. I think that they should take into account what COVID has shown us, that areas like Morden need more help, more health services, not less. So anyway, that's point made, but you know, clearly I am very passionate about lifting the life chances of those who need it the most in our community, and Morden is one of those places. Very proud, as I said, that every secondary school in Merton has been rated as good or outstanding. I'm very proud of things like providing full council tax support to those who are most in need. We've obviously seen the importance of that during the pandemic as well, that we've been helping our residents. And you know, for instance, when the free school meals were threatened here in Merton, we continue to provide £15 in vouchers to the children of the most disadvantaged families. So you know, I'm absolutely committed to you know, being inclusive in our community, making sure that that people who are less well off are included in the success story of Merton. And that's why in a place like Morden, you've seen the new leisure centre. It's why we've seen new homes in places like Hague Homes. We've been working with developers to make sure that the life chances of those who are least well off are given the best chances in the future. And talking of inclusive, I think it's fair to, if I just mention it, I don't think it applies to anybody here, but I am very proud of the work that the council is doing during Black History Month. My wife and son, as you know, are mixed race, and I live in a mixed family, and all sorts of things recently, including, you know, I think everybody knows that I'm mad keen on football, but like you see what happened last night at the football game and the abuse that that black players and even black stewards faced shows that the importance of Black Lives Matter for our community, and it matters really here for all of us in Merton. And I'm very proud that in my year so far, or nearly a year so far of being leader of the council, I've appointed the most diverse cabinet in Merton's 55-year history, with 2/3 of cabinet women and more than a half from ethnic minorities. And as leader, I want to reassure you and your constituents, because it's a very mixed area, Morden, that I intend to celebrate and build on our great community in all its diversity. Now, I became leader last year. My first announcement as leader of the council was to launch Merton Together. When the pandemic began, I was very aware of how many people in our community wanted to help each other. As I said before, it's one of the things that struck me throughout the pandemic. and they wanted to work together. They wanted to help people who were shielding or isolated or struggling financially or in any other way. And Merton Together was a part of that. And I've seen close to hand what that means. You probably know, with my wife, we helped to run a food bank at the start of the pandemic, and we were really struck by the way that the people of Merton, including from Morden, wanted to help each other. So I've seen extraordinary efforts by so many people in our community. And Merton Together was a joint campaign with our partners across the piece in Merton to come together to support residents who needed it the most. And through this forum, I'd like to thank everybody who got involved. And I know that includes many of you as councillors and many of you as residents. It's made a huge difference, and I'm very grateful. Becoming leader of the council during COVID-19 is, well, I've never known any other way to become leader. I think Stephen could have a different story of his experiences, but it's been a strange experience becoming leader in this time. So many things have not been normal and are not back to normal, but we want to help people to get back to normal. However, having said that, things for many people will never be the same again. We've obviously seen the council working with the NHS and others to keep everybody safe during the pandemic. But sadly, I'm afraid that some people have lost loved ones. And sadly, without losing, without anything as awful as that, other people have lost their jobs or struggled financially or, all sorts of other things. So there's a lot for us in Merton to get used to help people through the next phase. Others of us have also been affected in, thankfully less serious, but still quite significant ways, and that's going to have an impact on the council. We've had to get used to new ways of working, new ways of having meetings like this, which is actually quite good for many people who are excluded from council business because they're disabled or frail or can't get out. And that will affect the way that the council works in the future. There's been less going to the office. So whilst, and for many of us, that's been a good thing, but it's certainly going to change the way that organisations like councils operate in the future. So that's why throughout the summer, I asked Merton to run a project called Your Merton, which was a huge listening exercise across the borough. We listened to the views of many thousands of people to try and find out what it was that you in Merton wanted from your Merton, what you like about the area, what you don't like, things you think that the council does well, things that you want us to improve on. And I'm told that Your Merton has been the biggest consultation, most extensive consultation we've ever undertaken, with more than 10,000 interactions of people telling us what their priorities are, both now and in the wake of the pandemic. So obviously we're still going through the outcome of that, but I think that I can probably draw together some of the things that have emerged from the first responses that we've had. So I think first of all, I just want to say that it's very clear that what people absolutely love about Merton is its community. You love our parks and open spaces, which the council has done a really good job in keeping open and in good condition. And we've also spent much more time in the immediate area around where we live, much more than we probably would have done if we were commuting up to London or visiting people or going on holiday. And that's a good thing. It means that we're much more connected to our community, but it also means we're much more conscious of our local communities and our local neighbourhoods. And we're very proud of things like our high streets, but we're very conscious of what's going on in them. So I'm still very much in listening mode. I've been to the Overview and Scrutiny Commission earlier this year and said I was listening, and obviously the Your Merton exercise has been about listening. But I do want to talk about a few things that we have heard and that we're acting on. So first of all, I have heard very loud and clear that people are concerned about the cost of living. particularly with the cuts to universal credit, with the increases to national insurance, and with things like the cost of energy, the price cap being put up by the government, and petrol being scarce, and potentially those prices and gas prices going up. People are very worried about the cost of living. So in response to that, your residents who are in controlled parking zones should be pleased to hear the news that we are not now going to be raising parking charges after all. We've actually seen good progress in reducing pollution, for instance, through things like the school street zones, which Merton's got more of than anywhere else in London. And we've seen probably 1 in 6 of people with cars switching to less emitting vehicles in the last 18 months or so. So we have heard loud and clear that the cost of parking charges shouldn't be going up, and we have heard loud and clear from people that they will switch vehicles and they will reduce pollution without charges having to go up. So we have acted on that. We have listened. We've also heard very loud and clear that people want better homes. So obviously, if you've spent the pandemic stuck in an overcrowded flat with mold on the walls, you would know the importance of living in a nice home. So we've announced that we're going to be using the money that the council would have been getting from regeneration to make sure that there'll be hundreds more affordable homes. And we've also heard that although Merton's one of the lowest crime areas in London, everybody's spending more time in the area, and I think they're probably more conscious of what's going on in the area. And people have very much said that they want greater assurance around crime and antisocial behaviour. And it's probably been affected by things that have happened during lockdown as well, like the terrible instance with Sabina Nessa and before her Sarah Everard. So this week we announced that we would make a £1 million upgrade to our CCTV service to improve the quality of the images that they provide and the system's capabilities. So those are 3 areas where we've listened and we've acted, but I think there will be more to come, because I can't pretend for a moment that everything in Merton is perfect. I think that what we found during the pandemic is that we know very well that Morden is a brilliant place, but we also hear loud and clear that it's not a perfect place, and it's great that people care about it, but that means that you want us to improve it. So I think we've done some great things during my year, my first year, which has all been during the pandemic, to keep people safe, our friends and our families and our neighbours safe here in Merton. We've kept the parks open, kept the rubbish collected, made sure that our children continue to get a good education and get free school meals if that's relevant. But I can't pretend that there aren't challenges ahead. I really do think Merton's a brilliant place. I'm so proud of the way it's come together during the pandemic. But I'm here in Morden, well, not in Morden, but listening to Morden to find out what your priorities are, and hopefully then we can make Morden an even better place. So there you go. Thank you very much for inviting me. I promise that in the next little period, I'll do what I've been trying to do in the first year, which is to continue to do my best to make sure that Merton remains a great place for families and for people like our residents living here like you. Thank you.
Well, thank you very much indeed, Mark. And we have on the agenda an open session at number 4, and Mark will still be here during the course of that open session. So residents who want to ask him questions will be welcome to do so at that point. But first, we have Dr. Alg, Dr. Navdeep Alg, who is going to talk to us about cancer services. At least I think he is. Yes, yeah, there he is. Thank you very much.
Hi there. Thank you for the introduction, Nick. Sorry, I'm still stuck in my clinic, so I may be interrupted here and there, but hopefully not. Thanks for inviting me to talk today. So I'm Nav. I'm actually a GP in Rains Park, but I live in Merton as well. I'm the current cancer CCG lead, and I'm a Macmillan GP, so I also work for Macmillan, the cancer charity. And so today, just going to do a quick presentation, a quick rundown, really, on cancer and the pandemic, and what sort of challenges we're dealing with as healthcare professionals when it comes to cancer care, and what we're doing about it, really. So next slide, please. So as a quick outline, I'll try not to bore you with too many slides, but I'll give you an update of the current issues and challenges in Merton and compare it to other boroughs in southwest London. Talk about some of the cancers that we're particularly worried about, such as urological cancers and lung cancers, and talk to you about the community events that we've been taking part in and continue to take part in to help address some of these issues. Next slide, please. So this is a really rough outline of the numbers. Without getting into the nitty-gritty of it, the main thing to take away is the top of the chart, the top three things. So the pandemic, unfortunately, has meant that there's been a delay in the diagnosis of certain cancers. And that's due to a multitude of reasons, to do with normal services not being run, patients maybe not being so keen to see healthcare professionals. So a combination of things. The top three there are the ones that I'll be focusing on as potential areas of concern. So urological cancers, and that relates to cancers around the bladder, the kidneys, and so on. There's been a significant decline in the number of people diagnosed with these cancers post-pandemic, particularly prostate and bladder. Breast cancers have also, the new diagnosis of breast cancers have also dropped dramatically. And we think that's highly linked to screening services. And we also know that in some parts of southwest London, lung cancers are also not being picked up as they would have done pre-pandemic. Next slide, please. So this is the missing first treatment. So when we say missing first treatments, we essentially look at the number of people who have been diagnosed with a cancer and have had treatment for it now compared to pre-pandemic. And this is a really useful set of charts that show Merton compared to other boroughs. Now, southwest London as a whole acts together as a healthcare system or ecosystem. So if we look at prostate and bladder, so the urological cancers, fortunately, Merton is not doing too bad compared to other boroughs. So when you look at the percentages here, actually, where we've got the least reduction of diagnosis of bladder cancer and prostate cancers. Still, obviously, any reduction is still relevant. In real terms, that's sort of 7 people with a prostate or bladder cancer who have it but don't know that they have it. But obviously, compared to other boroughs, we're doing okay. Breast cancer, unfortunately, Merton is on par with other boroughs that are struggling. And if you put that in real terms, that's 25 women who have some form of breast cancer, likely early stage breast cancer, who don't know they have it. And the reason that that's occurring most likely is because of the massive backlog and delays with screening services. And again, it's a combined factors, including patients not necessarily wanting to have tests, but also services not being able to run as efficiently as usual, not being able to see the same number of patients because they've got to clean the services and so to clean the equipment and so on and so forth. And lung cancer, again, just going on lung cancer, luckily Merton is not, in a bad situation when it comes to diagnosis of lung cancer compared to, for example, Wandsworth, where they're really doing a lot of work on to improve that. Merton, the numbers are pretty much on par pre-pandemic. Next slide, please. So, just an explanation of why prostate cancers and bladder cancers could be diagnosed less so this post-pandemic. Particular blood tests like the PSA test, which is a prostate cancer screening test, often gets done with other blood tests. And we know for a good period of time during the pandemic, patients weren't having their routine tests. Sometimes even on advice of doctors, they were sort of worried about getting exposed to COVID-19. And so PSA tests perhaps weren't doing as much. Also bladder cancers, perhaps there's a reduction in diagnosis there because there's been a bit more patients sort of treated with antibiotics without necessarily having their urine checked. Both things that have been identified and have been sort of worked on. Next slide, please. So lung cancer is more a problem in Wandsworth, our neighbouring borough, but it's important to always emphasise the message across any sort of forum anywhere they would like to. We always mention, people with persistent coughs, blood in the sputum, unexplained weight loss, long-term smokers. It's important that they do present to GP services or any healthcare services and discuss their symptoms. Next slide, please. I will skip this slide because it's probably got too much information. So this is a set of communications that the South West London CCG and the cancer leads have been working on. This is a roundup of a lot of the digital work that's been going on in terms of TV, internet, YouTube, etc. And so there's been quite a lot of push, especially on social media, which is given us quite good feedback on when to see a doctor and what to be aware of. Next slide, please. But we're also not just doing digital promotion. There are services and charities in place to help improve cancer diagnosis and screenings for people who perhaps aren't digitally literate. So Community Links is a big charity working with Merton and other boroughs to help promote cancer screening services, for example. So they have a massive program to improve bowel cancer screening, and they have people who speak other languages to help promote people to do the bowel cancer screening test. This is a test that comes through the post for people of a certain age group to send a sample off to diagnose early stage bowel cancer. And we've also got other work in the borough related to improving our cancer screening of learning disabled people and other people who might be vulnerable. Next slide, please. So as I was saying, it's not just digital. We've got a lot of public-facing, non-digital work going on. This involves putting things on bus shelters, posters, and of course, in individual practices, we are identifying areas where there is particular issues and doing targeted work on trying to improve and case find people with those cancers. Next slide, please. Just to mention about breast cancer, the biggest thing with breast cancer is that we think it's related to screening. And obviously screening identifies early breast cancer before it presents as a lump. Some of the work that's gone on, so during the pandemic, the breast cancer screening services became more flexible in order to try and get more people to come. And so there were open invitations sent out rather than specific book time slots where people might miss the appointment and then not be able to book back in. There's consistent work looking at the data to try and continue to improve breast cancer screening. And the main message to send out is that breast cancer screening is on, and if you are eligible for a test, there will be services available in your area. Next slide, please. Just a quick roundup. My colleague Stephen, who's from the CCG as a manager there, has helped work through all of this. These are just some of the events that we've done. I know it's not all Merton, but if you can look at Merton, we've got one in Pollard's Hill. There was a big family sort of fun day where we had a cancer stall. We have an event planned in North Merton, which covers Morden actually, coming up in November. So the GP practices are getting together in that area to do a cancer awareness, cancer screening day at Vestry Hall. And I'll be attending that as well to sort of provide a face-to-face presence. Next slide, please. Just a picture of one of our engagement days. This was the one in Mitcham. And it went very well, actually. A lot of interest from public, and we were able to spread a lot of our information. We're always supported by Macmillan, who always help with these events. Next slide, please. Just mentioning the 6th of November, we have a cancer awareness day, and that's in, I guess that would cover Morden. That is in this area actually, so very relevant. Next slide, please. We'll skip this slide, that's okay. So just a quick mention about GP practices and how they're working together. There's been a big push from NHS England to get primary care networks, which are groups of practices working together with a shared aim. So all the practices in the UK pretty much have joined up to work together. So in my area, it's the Grand Drive Surgery in Nelson. In Morden, there's a Morden PCN, which contains about 4 practices which all work together. And they all deliver key messages. So if we go next slide, one of the big messages for PCNs is to help detect cancer early. The government set out requirements for practices to work on this. So there's a lot of work in the background. Next slide, please. And so, the big thing that we're working on, for example, is reviewing our referrals to cancer services. So each practice gets together at least sort of 6 monthly to discuss the current cancer statistics and also to compare referrals to go into cases and to look where things could be improved. We're also actively involved in trying to improve screening, because we know a lot of screening programs took a dip during the pandemic. A good success story is cervical cancer screening. That massively dropped during the pandemic, but with all the work and money and help that's been provided, we've managed to catch up to post-pandemic, to pre-pandemic levels now. And obviously, the third point that this is part of the process, is engaging with not just ourselves, but engaging with the public, engaging with community services, charities, and providing a presence. And obviously, part of my reason for being here today is obviously to actually say that I'm here to help support any events, whether face-to-face or online, where I can, to help promote and help spread the message of cancer awareness, really. Next slide, please. Yeah, that's just a brief summary, very kind of brief and high level, I guess. I'm happy to answer any sort of questions that you guys might have.
Thank you very much indeed, Dr. O. I'm going to move the agenda around a bit, because I know that Councillor Allison needs to leave us fairly soon. So I'm going to ask, first of all, anybody who is a local resident rather than the councillor, if they want to ask any questions, and if they could introduce themselves. In fact, could you introduce yourselves generally? Brian? Brian, would you introduce yourself? Unmute yourself first.
Hi, I'm Brian Dillon. I'm actually chair of Morden Connected and also chair of Healthwatch Morden. So I have an interest also as a local resident. I've no specific questions for you, Deep, but thank you very much for the presentation. And I'm glad to see things are mobilising again. Thank you.
Who else have we got? We've got Stephen Nzikwe. Are you a resident or an officer?
Hi, I'm Stephen Nzekwe. So I work as part of the South West London Cancer team. So I support NAV in his line of work as well.
Thank you very much indeed. And I've got a user. Can we have your name, user? I don't think we're going to get his or her name. I've got Mark Gale. Do you want to introduce yourself, Mark? Mark clearly doesn't want to introduce himself either. So from those people who've introduced.
Hello.
Oh, hello, Mark. Do you introduce yourself, please?
Hi, sorry. Yeah, long time Morden resident. Got a quick question, but maybe some can help. On the 2nd of September, there was a meeting in the Civic Centre for the Southwest Waste Plan, where the members, other borough members as well, were included. There was no air quality data. It was promised that they were up in Merton in September, and the data would be put on the website live. Is anybody aware of that data on the website yet? Thank you.
Mark, I don't know if you got all of that, and if you're able to answer.
I'm afraid that the air quality data that may or may not have been intended to go to the meeting on the 2nd of September is not the thing that I know most about in the entirety of the borough, and I can only apologise for that, for not knowing the answer to your question. My only sort of observation really about air quality is that the findings that we've looked at over the last year suggest that air quality has improved across the borough. We're needing to probably analyse the extent to which that's down to the pandemic leading to people driving less. But I think it's a start, and I think it's a start that that people are moving. By our data, about 15% of people have switched cars to less polluting vehicles within the last 18 months. And that in itself is going to have an impact on residents. Also, the overall increase in the number of trees in the area has a marginal effect on pollution, which is good, particularly around some of our streets and neighbourhoods. So I think there's a reasonably good story to tell on air pollution, but I'm afraid I just don't store the kind of detailed information that you wanted there about a meeting from the 2nd of September in my mind at any one particular time. So I have to answer in generalities.
Chair, I've made a note of that question, so I'll follow up with officers who respond.
Thank you, Chris.
Mark, thank you very much. Mark Allison. Mark, the Sustainable Communities Scrutiny Panel meets again on, believe it or not, Monday the 1st of November. So if you wanted to put something down in writing to me or to the chair, Aidan Mundy, I'm sure we could get an answer for you at that stage. Okay.
It certainly looks positive. We're now going to a real live situation as opposed to using the tubes which hang around for ages, which we then wait like 18 months to find out the data from. So certainly a move in the right direction, I think. Thank you.
Thank you.
Nick, you've just muted yourself.
I'm sorry. Any other questions for Mark Allison? Mark, I think you needed to go, so I suggest you are free to go now should you need to. Okay.
Yeah, thank you very much for inviting me. It's really nice to see you all. Good luck, everyone.
Good to see you, and good luck this evening. Any questions, panelists, generally to Dr. Alg? Dr. Alg, I think you too are free to go should you want to. If you want to stay, you're more than welcome to do so.
Thank you. I'll take my leave and go work. Thank you.
Can I just say, Dr. Alg, would it be possible to share your slides with us? Because they were interesting and I didn't read all the detail I would have liked to have read. And thank you very much for your presentation. It was interesting.
And thank you for joining us when you've been so busy in a clinic.
Thank you. Sorry, yeah, Chris has got the slides. I'm happy for Chris to send them around. Yeah.
Thank you.
Thank you very much. Thank you very much indeed. We have our next speaker is known to many of us. It's Barry Causer, who's going to talk to us about the COVID situation, I believe.
Thank you, Councillor. And I know that Chris has some slides that he's going to share. But firstly, thank you for having me back. It's always nice to come back to talk to you all. And clearly, although I have the pleasure of talking to you this evening, the COVID response is very much a cross-borough approach. So that COVID response has been developed by many parts of the council, the NHS, our thriving and fantastic voluntary sector, our residents who have volunteered in huge numbers, and of course our local councillors as well. So I get the pleasure of talking to you this evening, but we just need to acknowledge the fact that many people have contributed towards our COVID response. So I'm Barry Causer, I'm the Public Health Lead for COVID Resilience. And next slide, please, Chris. So what we are seeing there's lots of text, but I'm going to take you through the different parts of the slides tonight. And what we've seen over the most recent reporting period is a slight reduction in the number of new infections in Merton. So we're hovering at the moment in and around that 250 cases per week per 100,000 residents. So what that means in real numbers, it's about 70 new infections every day within Merton. And the note of caution for us all is that is particularly high. That is still high. We are no different from the rest of southwest London and London in general. So we're kind of in the middle of the pack, but we are a little bit concerned about those that getting stuck at that new infection level. And that note of caution that we are seeing that signal of perhaps slight increases in the number of new infections taking place within Merton and London. And that is to be expected. As schools have gone back, people are returning back to the workplace. They are socially mixing, as we all are, even more than we were before. And clearly, when we increase the social aspect of our lives, then it increases the number of infections. And so we saw a few weeks ago what happened in Scotland. So when all those things happened and they saw exponential rises in the number of new infections, we're not seeing that exponential rise, but we are seeing some slight concern about some increased numbers. So Merton, we are no significantly worse than the rest of southwest London. So we're that middle of the pack. But when we delve a little bit deeper around the numbers and the data that we have, when we look at east versus west on the number of new infections, throughout the pandemic, and you may remember me saying this before, is that east and west have been crossing over each other. What we can see at the moment is that the infection rate is slightly higher in the west of the borough compared to the east, but they are crossing over each other at certain times. The majority of our cases at this stage are in the young people. They are in that 0 to 15 category, and that is to be expected again, because that is many of our 0 to 15s are clearly unvaccinated, and we're seeing a number of outbreaks in schools. But we are seeing a number of breakthrough infections. So that means that double vaccinated individuals are still able to, unfortunately, get COVID-19. So we're seeing that. And that's the importance of that booster program for the vaccine, which I'm going to come on to a little bit later. But as well as talking about new infections and the case rates, we need to think about the impact of those infections, because clearly we're in a different stage of the pandemic because of the success of the NHS's vaccination program. So we need to look at the impact, and when we look at the NHS indicators, what we're seeing is admissions are looking pretty level, pretty stable at this stage. But it's not going to take a lot to put additional pressure on the NHS. Clearly, we've heard from Dr. Alg this evening on the work of the NHS to do catch up on cancer services, etc. There are still other respiratory illnesses, and it's not going to take much to overcome them. On that impact, I'm pleased to say that the death rate is particularly low at the moment. So again, that is due to that success of the vaccination program preventing severe disease. So the autumn and winter plan has been published by the government, and you should read it. It's about 37 pages. It gives us the direction of travel for how we're going to work together to tackle the pandemic in the stage that it's at. So plan A is around vaccination, test, trace and isolate, and clear communications and managing the risk at borders. And then if cases continuing to increase and it increases the impact and the pressure on the NHS, then there's a plan B that's been set out. And again, that includes increasing the communications, introducing COVID passes, mandating face coverings, and encouraging people or asking people to work at home. So the plan is there for us to look at. On vaccination, vaccination continues to be our front line of defense against COVID-19. And there are 4 parts to the vaccination program. The first part of this is what's being now being referred to as the Evergreen Offer. And what this means is it's never too late. We know that there are 66,000 people in Morden that have not had their vaccination yet, that are over 15 years of age, apologies. And so that Evergreen Offer is really important, that if you previously declined, but now actually you've seen your friends and family members take the vaccine, you've seen the benefits of the vaccination program, then it's never too late to get that first and second dose of the vaccine. The second part of the vaccination program I've kind of touched on already, about the real importance of that vaccine booster program. And the booster is in response to that waning protection. And that doesn't mean that the vaccine isn't working, it's just the protection reduces slightly over time. And so it's really important that those people that are eligible for that booster program, so 6 months after their second dose, do take that booster. And that's initially rolled out to priority vulnerable groups. So those that are living in care homes, the over 50s, frontline health and care staff, and those with underlying health conditions. The third part of the vaccination program is about the third dose. And this is the third dose for those residents that may be immunosuppressed. And this means it's not a booster, it's a third dose. And this is in direct response because those individuals perhaps didn't have the full immune response from the 2 doses of the vaccine. So that's why we talk about the third dose rather than a boost. The final part of the vaccination program, which has been much in the press, which started very recently across the country and in Morden, is that universal offer for the first dose for 12 to 15-year-olds. Our NHS colleagues, us within the council, clearly are working very, very closely with our amazing school leaders, our head teachers, so that we can support those young people, their families, their carers, to make an informed decision. And we're working hard to increase the uptake of that vaccination program, which is absolutely critical to prevent and manage those outbreaks. So then we kind of come on to the things that we can all do to help keep ourselves, our family and our communities safe. COVID-19 is still a serious health risk for us, and we do need to maintain that note of caution and protect ourselves. And the first part of this is that if you think you have COVID-19 symptoms, to stay at home, take that cautious approach and get a PCR test. Those symptoms, you've heard much about these over the last 18 months or so. A new continuous cough, a high temperature, a change or loss of sense of smell or taste. And again, if you're not sure, is this a new continuous cough? Have I lost my sense of smell? I'm not entirely sure. If they're mild symptoms, please stay at home. Help get that PCR test and break the chain of transmission. Really important for us. The next thing we can all do to take part is lateral flow tests. So I've got a box of 7 test kits here. I don't know if you can see it. There we go. That you can collect. Lateral flow tests are an important part of us to identify those that are infectious. 1 in 3 people have no symptoms, but they have COVID-19 and they will be transmitting the virus to other people. I think it's fair to say that there's lots in the press about the effectiveness of lateral flow tests. But what they are really good at is identifying those people with a high viral load. So that's the most infectious people. And so for our purpose of test to find, so to find people that have the virus, that are transmitting the virus, that don't have any symptoms, they're good for us to use. So I'd encourage you all to take part in regular, and that means twice weekly testing. If you have children in the household that are going to school, to make sure that those secondary school pupils are taking part in regular testing as well. And even if you are double vaccinated, fully vaccinated, to take part in that regular testing program, because as I say, that breakthrough infections, they are taking place. To give you a bit of context and a few numbers, perhaps, on the importance of lateral flow, in the most recent reporting period in Morden, excuse me, there were 15,000 LFTs taken, and of those, 124 of them were positive. So that's 124 people that were going to work, going to look after their loved ones, maybe going to shopping and do all those different things, transmitting the virus without knowing. So we're doing absolutely nothing wrong. But by taking part in that regular testing program, we were able to identify a positive case and get them to isolate to break the chain of transmission. So there we go. So vaccination and regular testing is really important for us. The next one is if you're not well, stay at home. I think we used to have a badge of honor to go to work and to continue doing things with a drippy nose and a cold and a flu. Really important to, again, to recognize that actually the way we work now on Zoom, most people can perhaps and hopefully not go to the workplace if they're not well. Really important not to share those illnesses. Ventilation is absolutely critical. So again, if you're going to meet up with someone, try to do it outside. But if you're doing so indoors, then open the windows or doors to make sure we've got ventilation coming through. Continuing to wear face coverings in crowded places, on the tube, on the trains, etc. And maintaining the use of the COVID-19 app, regular hand washing. And these are the non-pharmaceutical interventions, the things that really work to prevent onward transmission of the virus. And these are the things, alongside vaccination and regular asymptomatic testing, that's going to help us bring those case rates down within Morden. The last line there is about the importance of health improvement programs. So there's no better time to make those changes, to be a healthy weight, to stop smoking, reduce alcohol uptake, and to manage those long-term conditions. We have good services in Merton. Some of them we commission within the borough, within public health team around stop smoking, etc. So we can share the information with you so that we can encourage people to take part. The other thing that we can do to look after ourselves is to get a flu jab. So flu season is upon us, and it's really important that if you are eligible for a free flu jab funded by the NHS, to take up that offer. And actually, if you're not eligible for that free flu jab, to go to your community pharmacist, and for a few pounds, you'll be able to get a flu jab too, and it helps protect you and the community around you. Within the council, within LBM, we're leading from the front on this. We are offering staff members the opportunity, if they don't get a free flu jab, to go and pay for it themselves, and they can claim back up to £15, because we do want to increase the uptake of the flu jab by our staff. Next slide, please, Chris. Excuse me. This is an image you may have seen before, and hopefully you're going to see more of it. This is kind of our umbrella brand for Better Health Merton. If you go to the website, Better Health Merton, we're going to share this widely on social media and through our newsletters. It gives you the links to those health improvement type services that are going to be able to help support you to make those small changes. Next slide, please, Chris. Last slide from me this evening is about opportunities for action. We've still got our network of COVID-19 community champions. Our champions have been phenomenal throughout the pandemic. We've met them every single Wednesday at 12 noon and 7 p.m. on a Wednesday night. I sent my apologies this evening to join you tonight. But we've got 170 of them from a range of walks of life, and you can still join us. So we meet on a regular basis, give you information that you can share with your networks, and that's how we're going to increase the reach of our comms and our messages. At the end of last week, there was a vaccination Q&A for parents or carers of those young people that are eligible for the universal offer of vaccines. And so the link there takes you to the recording of that webinar. And it's a really important message and a really important a tool for us to share with our network. So I'd encourage you to do so if you're able to. I was speaking about the impact of COVID-19 a little bit earlier, and some of the things we now know we put in place nationally and that had a negative impact. So we asked 14,000, the central government asked clinically extremely vulnerable people to shield, to stay at home, to protect themselves. We know there was 14,000 of those CEV people shielding within Merton. But the shielding protected them. If you remember, that was prior to the vaccination program, and we're in a different stage of the pandemic at this stage. But it did have an impact. It had a negative impact. And what we're seeing now is some residual anxiety. So we've been working really hard to listen to our residents, to listen to our voluntary sector communities that are working directly with frontline with residents. And we've heard stories about people saying they've been shielding all this time. They are that nervous and anxious about the virus that they are never leaving their homes again. And this is really worrying for lots of different things, and we're going to do something about this. The first stage we're going to do, we have a CEV shielding forum. So we're going to have starting the conversation with our residents that we're shielding to understand the impact, to understand the anxiety, so that we can support them in the next stage of the pandemic. So something really positive that we can try to do to support them. If you work or represent or work in partnership with voluntary sector or organisations in Merton, we still have Merton Giving. So a range of organisations put some funding in a pot to help with our COVID response, and they've done some amazing things. The next deadline for applying for some of those funds is the 6th of December, so it's coming up. There's more information on the Merton Connected website, who've done a wonderful job for us working in partnership. Final thing to do, opportunity for action, is to sign up to the Merton COVID-19 newsletter. This still has high rates of opening. It's still one of our key resources to spread the messages and increase the reach of awareness of testing, vaccination, shielding forums, and all those other things. But I'd ask you as well, if you have any opportunities, you might have a newsletter or a small group or a large group that you think that you would like someone in public health or our COVID response team to come and talk to you. Let me know. We're more than happy to come and continue that ongoing engagement. throughout the rest of the pandemic. Last thing I'll say before I hand back to Councillor Draper is the image on the right-hand side of the screen you can see in front of you. So this was developed by our young people in Morden. So really so proud of them first putting their hand up and getting involved, but then producing fabulous resources. And what they were telling us was, we don't really understand the difference because it's really complicated, which it is, which test to get. And so they produced an image there that just shows the difference. So on the left-hand side, if you do not have symptoms, take part in a lateral flow testing twice a week. These are the things that you can do without symptoms. But if you do have symptoms, you need to go to get a PCR test from the NHS website or by calling 119. Next slide, Chris, please. And I'll hand over to Councillor Draper. Thank you.
Barry, thank you very much.
Nick, you've muted yourself again.
I'll get used to this one day. Sorry about that, Barry. I was just going to say that was brilliant, and throughout this pandemic, you've been a shining example to all of us, and you've really helped guide us through. I am very grateful indeed. Are there any questions for Barry? Sally, did you? No, I have one, Barry, if nobody else has. I was listening to the radio earlier on today, and apparently, on top of everything else, there's an epidemic of extremely bad colds that some people are actually mistaking for COVID. Have you got any ideas on that, or anything that you'd like to tell us about it?
Yeah, thank you. And it's a really important question because they can be confusing about the symptoms. There's some overlap between those. What we know is throughout the pandemic, the measures that we put in place to protect ourselves and our communities from COVID change the transmission of flu and those viruses. So our immunity levels are lower towards those flus and those colds. And so it's really important that there's some nasty symptoms going on. And so what I would suggest is, first of all, get your flu jab. Anybody should be able to access that flu jab. It's a really important message for us. Secondly, if you're not well, please stay at home. Don't go to work. Don't go to your faith group. Don't go to your football club and all those different things and share those viruses. Look after yourselves and your family. And I guess the final thing there is that if you are not sure if the symptoms that you have are COVID or a cold or a flu, please take that cautious approach. Stay at home. Get a PCR test. The test results are being turned around pretty quickly at the moment, so you'll get a result probably likely to be next day. And so again, if it is COVID, then we can help stop that chain of transmission. So cautious approach, get a flu jab, and please try to reduce that transmission by staying at home and don't go to work.
Stephen, you have a question?
Yes, it's the question of Barry. Barry, a GP's offering a pneumonia jab as well now.
I'll have to check that one for you, Stephen. Apologies, I'm not entirely sure on that one, but let me find out and I'll come back to you if that's okay.
I can tell you I was given one last year, Stephen. I've not been offered one this year, but I don't know whether it would be a yearly thing anyway.
Thank you, Barry. If you could look into that, thank you very much.
It was
horrible. For everything you're doing.
Horrible. Barry, brilliant. Thank you very much indeed. Right. We're on the last item on the agenda, and that is an open session where people can actually ask questions of all of us, I suppose. That's obviously ideally for residents, but I'm sure that if councillors wanted to chip in, you'd be welcome to do so. Do you remember that old song, Silence is Golden? I'm not going to sing it, but I suspect that if nobody has got any questions, that we can end the session, in which case...
I've got one item on the Northern line.
Oh, yes, I'm so sorry, Chris.
That's okay. So we've just been notified by Transport for London that as part of the bank improvement plans and the works they've been doing around Bank Station, they're going to need to close the Bank branch of the Northern Line for quite an extensive period of time. This is going to be the 15th of January until May 2022. So it's about a 16-week closure. So it'll be closed between Kennington and Moorgate. So what they're going to do is try and mitigate some of the impacts of that by increasing services on the Charing Cross line. Everything coming out of Morden or coming into Morden will be on the Charing Cross line. But of course, there's also the new stations going out to Nine Elms, which some of those Charing Cross trains will still go to. The TfL are already saying they expect the line to be busier than usual, especially in central London through Charing Cross to King's Cross, that territory. So if you can make alternative arrangements, that might be the best way of doing it. If you have to cycle, good luck to you for that. I think that will be probably the easiest way to get around it. But it might be worth trying to think about those plans now.
That's cheerful news, isn't it? I tell you what, that's Wandsworth again, messing it up for the rest of us. Grrr.
Well, the pretty pictures they have of what Bank will look like when they're finished suggest the works will be worthwhile and it will increase capacity of the line significantly once the work is done. But obviously, you have to get through the pain of the work being done before you get the benefit.
Well, anyway, I'm sure it will indeed be worth it all in the end. Thank you very much indeed for that, Chris. Any other contributions before we say goodbye? In which case, bye-bye, everybody, and thank you very much indeed for coming. Thank you very much.
Thank you, and good night.
Good night. Good night. Good night all.